The last few years have seen significant changes in the national healthcare landscape, including new payment and delivery models, and a push for better coordinated and patient-centered care. Successful implementation of these changes will rely on a strong foundation of health information technology. Since the implementation of the Meaningful Use Electronic Health Records Incentive Program, there has been a dramatic rise in the use of EHRs both within hospitals as well as by office-based providers. This broad adoption of EHRs is enabling greater health record portability, both through direct provider-to-provider exchange and through state health information exchange organizations. It is envisioned that these HIEs will form the foundation of a nationwide health information network that will enable your health information to be accessible anywhere you go throughout the country. But while the increased accessibility of health records is critical for enabling quality integrated care, it raises questions of how to ensure patient confidentiality and trust. It will be important to find the balance between a patient's legitimate desire to maintain the privacy of sensitive health information while facilitating the sharing of information that will improve treatment safety and effectiveness. To achieve this, it will be important to give patients meaningful choices for sharing their health information, including the ability to share parts of their health record while withholding more sensitive information from some providers. To address this issue, the Office of the National Coordinator for Health IT convened a community initiative on data segmentation for privacy through their Standards and Interoperability Framework initiative. Through this initiative, the Substance Abuse and Mental Health Services Administration worked with federal and community stakeholders to develop standards and guidelines for enabling data segmentation and management of patient consent preferences. Consent to share can receive standard health records from an EHR or HIE. It then applies a patient's consent choices, such as redacting their substance abuse treatment information from their health record. Consent to share then sends the modified record onto the receiver if it has been authorized by the patient's consent. In a recent poll, the National Alliance for Medication-Assisted Recovery asked their membership how they feel about the importance of confidentiality regulations. 72% indicated that confidentiality is very important and that they wouldn't want their clinical information to be given to anyone without authorization. An additional 19% would like to see the regulations expanded to cover general healthcare providers. Only 9% said that they wouldn't mind if their data were available for medical purposes. In a broader poll recently conducted during a webinar with behavioral health providers and consumers, participants were asked how concerned they or their patients are about their behavioral health information being shared with other healthcare providers. 90% were at least somewhat concerned about the sharing of their behavioral health data. However, when asked how important care coordination is to improving patient outcomes, participants overwhelmingly acknowledged the importance of integrated care.